That we get support from everybody, from the community, from the medical profession, from the government, so that this service can be spread.
She further explained that 20% of the patients who report to Butabika Hospital plus other medical clinics are epilepsy, an indication that the disease is on a surge.
I've seen in our health facilities around the country where we run mental health clinics that about 20 to 30% of people who attend mental health clinics around the country actually have epilepsy. So the numbers are huge out there in the communities. And so we need this awareness to go around so that many people can get to know and they can come to get treatment.
Dr. Richard Idro, the Associate Professor of Pediatrics and Child Health at Makerere University, explained that 23 people have so far been operated since 2015, but stressing that they are improving in the area of capacity building by training more personnel.
We have had 23 children operated on. The first 10 about 2015, and then the 13 in the recent days. 8 in Kiwa Hospital in Bale, the other 5 in the hospitals around Kampala. We have programs here. We are training technicians who conduct the neurophysiological tests, the EEGs. That one has been going on through the Molago Makerere Epilepsy project. And then for specialists, we are currently training quite a number of people.
Ms. Nekesa Sarah, the Executive Director, Epilepsy Support Association Uganda, an organization that specializes in helping people with epilepsy, raised a concern about the existing knowledge and treatment gap, saying the medicines are not readily available in Uganda.
There's a very big challenge around knowledge. There is a knowledge gap in epilepsy. Not every medic understands epilepsy, and there is also a treatment gap because there is also the drugs that are available are not readily available in Uganda. So persons with epilepsy, drugs are a meal for them. However, when they go to such facilities, most especially in rural settings, the drugs are not readily available, which precipitates their seizures.
Church of Uganda Family TV spoke to one Nakitende Victoria, a mother to an epileptic child, and this expressed the high stigma attached to the child by the community as the major challenge she encounters.
Omwana ono bamuvuma nnyo, bamuchokoza nnyo, netuuka okugamba senga oba nalina ssente omwana andimututte mu kisulo n'avaawoko kuba ye buli ssaawa gwe bakuba gwe bawaayiriza kati bwe bityo.
John Baptist Ahumuza, Church of Uganda Family TV News at 8.
770,000 Ugandans is really a very big number if all these people are living with epilepsy. Unfortunately, before we came on air, I got something that is strange. We all thought that epilepsy, people who manifest with epilepsy are only those who fall down and then they crave for support. But I'm told that's not the only indicator of epilepsy. Now, that and more is what we are going to talk about, but most so how epilepsy and mental illness are interrelated. That's what we are looking at in today's Family Hour. It's a Tuesday where we talk about family health. We welcome you to the show. Edwin Austin Mukalazi is my name. With us is Martin. I believe he has become our own now, part of this panel. We've been with him for quite some time, and here he is for us, with us, to take us through this topic. Kindly greet viewers, and then we shall get into a discussion later.
Good evening, viewers. Glad and happy to be on Family TV again to help sensitize and promote mental health in the people, in the society at large.
We are grateful to have you again. Just in case you are joining for the first time, and or you know someone who you would like to follow up this conversation, please inform them that we are live on our YouTube channel. But also you can be part of this conversation as you send in your comment, you send in your reaction in the live chat, but also on our other social media platforms, Facebook, YouTube, X, and you can as well stream live on our website, www.coufamilytv.co.ug. But here we are. We want to understand epilepsy. Of course, there have been a lot of talks about epilepsy. Even the news story we had before we came on air, someone said that very many people don't understand what epilepsy is. What is epilepsy?
Epilepsy is a brain disorder,
Okay.
or a brain condition, or a disease that affects the electric, the brain. The brain is an organ on the human body that sends and receives information from various parts of the body. So in doing so, it uses electric discharges. So when these discharges do not coordinate, you get a brain disorder we call epilepsy. And it affects the normal functioning of an individual, the emotional bit, then the movement itself, the level of consciousness, and it can as well result into abnormal body movements. For example, jerkings, what we call fits of the arms, the entire body. Yes, so that is epilepsy.
Hey. Well, what causes epilepsy? Is it genetic or there are environmental factors?
There are a lot of causes.
Okay.
If you remember the other episodes I told you most of these things we don't know what brings them. But we believe that it is because of the other uncoordinated impulses. Yes. The electric discharge, the uncoordinated discharges that bring about this abnormal behavior of the brain that causes a seizure. So if a seizure is a sudden or abrupt, okay, disorderly bodily movement, it is abrupt, it is uncontrollable, it causes an individual to lose consciousness and then have the other jerkings we talked about. Some individuals may have the jerkings, some individuals may not have the jerkings, but they may have other aspects like loss of consciousness, and then sensations, like seeing things others do not see, feeling tastes in the mouth that are not there, then some blackout. Some have muscle rigidity or the muscle loosen stations, basically. Some have the rigidity. Then some may also lose control over their muscles that control, for example, the bowel muscles. Some may urinate on themselves. Yes. So other causes are basically aligned to disorders of the brain. For example, intoxication, yes, trauma. But genetics also plays a role, like you said. Most of these patients, you may find it is genetic. It has been running from the family. The grandpa had epilepsy, then it goes to the father, it goes to the son, and then to the grandson. Yes. And the others can be diseases, brain diseases that involve the vascula, the blood vessels. For example, a stroke. A stroke is basically an occlusion of the blood vessels in the brain. So if you ever have those issues, they may lead to epilepsy. Then intoxication, like poisoning, alcohol, that affects the brain. Then you may look at other diseases, like basically also brain diseases like dementia. Yes, there are high risks in children who have autism. Have you seen a kid with autism? Autism and ADHD, attention deficit and hyperactive behavior. Those people correlate with epilepsy most of the time. And the other causes can be, well, maybe the others could be risk factors. Yes. We've talked about head injury.
And as we talk about risk factors, does this mean that no one is safe when it comes to epilepsy? Anyone is at risk of having epilepsy?
Yes. Anyone is at risk of having epilepsy, regardless of the age. You can have it. Some children have it because they had brain deficits when they have perhaps trauma when they were growing up, or the mother was intoxicated with some poison. It can be, there are a lot of poisons, and can be because of the labor difficulties when the mother was pushing the baby, delivering the baby. Then the child had some trauma on the head. It can be due to nutritional deficiency. Yes, when you lack, especially those vitamin B's that help, the vitamins basically that help the brain to function well. If you have deficit in such nutrients or vitamins, it can also predispose you to epilepsy. Then, like we said, an accident. You don't know when to have an accident.
Yeah.
Yes. So you may have an accident and then you have head injury, you have then you may develop a vesicular disease at a certain time.
Okay.
Then there are also medications that can bring about epilepsy. Yes. You may be on some treatment, and one of the side effects becomes a seizure. It may not be epilepsy, but you may get a seizure because of some medications. Yes. So everyone is at risk, and it is not a disease like people think that you can. First of all, it is epilepsy it is not contagious like people think. Yes.
People believe that when the saliva of someone who is under an attack, you get into contact with that saliva, then you also get it.
No, that is a myth, and it is not contagious in any way. Yes, because we've been dealing with these people and I don't have epilepsy. Yes, I've been helping them, feeding them, and I don't have epilepsy.
Okay.
Yes, so it is not contagious like people assume or believe it to be. Some people have gone extra miles of isolating these people with epilepsy.
The lady just said it in the story that ran before.
Exactly, that lady. You feel the suffering she's going through because of her child. So it is not contagious. Helping an epileptic patient will not put you at risk of acquiring epilepsy. Yes.
Well, you talked about the risk factors. Let's look at the risk factors.
Yes, like we've admitted. Alcohol use. Okay. Then there are sports. These sports that involve knocking each other.
Like rugby.
Yes, exactly, rugby. Then rally, this motor rally. Okay. Where trauma is evident enough. Okay. Then an accident. Okay. Then we talked about the genetics.
Yeah.
So if in your family you have that trait, there is high risk that you may get epilepsy yourself. Though some people may not have epilepsy, despite the fact that there are other people in the family with what? Epilepsy. But you are at more risk than those who do not have any family member, a close one, to say, who has epilepsy. Yes.
What about the misconceptions around epilepsy? Because like one, you talk about it not being contagious, but also there are a number of things that people say out there. Of course, when you find someone who has just fallen down, and then people fear to get closer to them because of a number of misconceptions that surround. But also, the woman just said it in the story, that the child is always accused of doing a lot of things, but also some people look at these children as a curse or a misfortune or what and all that. Let us talk about some of the misconceptions that you people can come out and clear.
Yes, the misconceptions align more with the symptoms these people experience.
Okay.
I'll give you an example of an individual who gets a fit, a seizure, and then just stares, loses consciousness and stares, and all of a sudden you are calling this individual, but he's not attentive. He's out of this world.
We say they are absent-minded.
Yes, absent-minded. So usually you look at such a person, and there's a term in Uganda, magube. You get it. Oyo magube zavako. He has lost the ability to think or do what. So it's a mixed conception also. That person may have epilepsy, but you're taking it as if this person is out of this world. It's not attentive. Magube. I don't know how to construct it back to English, but it's kind of humiliating aspect. Magube, that is one of the misconceptions. So people think she's retarded, basically. I think that's the right term. This individual is retarded. Okay? Mentally. That is one of the misconceptions. That person might have epilepsy because it is affecting his cognitive functioning, the attention and the concentration. Then all of a sudden he's staring at. Okay? There's some of the other signs will be the warning. We have the warning signs.
Okay.
So a person or an individual who is about to fit or get a seizure, we usually have warning signs, what we call owl. So these warning signs can come as a different taste in the mouth. Person gets a weird taste in the mouth. Then all of a sudden this person will start chewing something in the mouth. Okay. Then some feel some sensations in the stomach. Okay, like a raising temper in the stomach. Others will smell some irregular smell, like they will feel like there's something smelling that others are not smelling. Yes, some will become sad. Some will go into a loud cry. All of a sudden you're seated with me and I start crying, shouting on top of my voice. So the misconception now will come in, all the other myths that I'm possessed. You get it. So people will try to avoid such an individual.
They'll say you're destructive.
Yes, he has spirits that come and possess him. So that is another concept on the misconceptions. Yes. So these people believe this individual is what? Possessed. Okay. Now, part of the warning signs also can be the restlessness or aggressiveness. That's why the other mother was complaining that they accused was it the daughter or the son?
I think that she didn't reveal the sex.
Yes. So they are choosing that particular child of some misdoings, perhaps.
And they are always beating the child.
Yes, and that could be because of the other aura. When she's about to feed, she becomes restless. Okay? And aggressive. Then you find all of a sudden she's beating other people. Then in defense, the other people will also what?
beat
because for them, they don't understand that this individual is about to have a seizure. Yes, you find most of the individuals with epilepsy have wounds.
Yes.
And have injuries. Yes, because individuals do not understand that when this individual is about to feed, goes through all these symptoms or characteristics come about. So you'll find others who will become withdrawn. Okay? And some individuals who are now in the know of their symptoms, whenever such a warning sign comes, you'll find he has isolated himself from other individuals. He finds a dark spot, hides there. Okay? Then others, because they cannot control, you find they are falling into burning, maybe a charcoal, maybe oil. That's why you find a lot of burns with people with epilepsy. Yes. And the other is about the being contagious. You see, when you look at one of the causes, we said it is genetics.
Yes.
So people believe that because in the family so and so had it, and maybe Martin got into touch with that individual. At a certain point, Martin also develops epilepsy. So they think it was contagious. So they think that we better isolate Martin. Nobody should touch Martin so that we stop the reoccurrence of such a disease. Yes.
Now, as we go for the break, maybe what we would like to know is if someone is under that attack, for how long can they stay in that, or it depends on the response?
No, there are various types or various forms of epilepsy. Yes.
Let's take a short commercial break. When we return, we shall start with now the various types, and then the responses that is needed.
That you can now enjoy great enriching shows anywhere through the Family TV app. Here is how to download it. Open Play Store on your phone. Search for the Family TV app. Click Install. After installing it, open it and enjoy enriching content anywhere, everywhere, anytime. Family TV, enriching lives.
When you are in the Lord, when you are sealed in the Lord, the devil looks at you and you are glittering. The devil locates a crown. For any person that the devil locates with a crown, the devil will never eat them because they belong to the Most High.
Friends, don't you give up in any form of hardship. Don't you give up, for Jesus encourages us and says, even at the point of losing your life, for the sake of Christ and the gospel, it is okay.
My dear brothers and sisters, let us remember that God is still reigning on his throne in heaven above, and let us trust in him. Let us rely on him. Let us pray each and every time. Let us not give up on showing ourselves out into the world that the Lord Jesus Christ is still king and he still reigns.
You and I are here to reign on the earth, not to complain, not to grumble, not to play victim, not to quarrel, but to reign on the earth.
I pray, Father, that you will release the fourth man to destroy every fire, to protect your people who are in every furnace, and set them free in the name of Jesus.
Moses, Ramesses, you grew up together, close as brothers.
Remember their prophecy. Samson, chosen by the living God.
You dare to defy me? Let the furnace be heated sevenfold. Bind them and cast them into the fire.
It begins.
Take the ark!
This is Church of Uganda Family TV, enriching lives.
Welcome back from the commercial break. We are looking at epilepsy. I don't know whether this is also epilepsy or what, but we are back from the break, and we are looking at epilepsy and mental health. But before the break, we wanted to look at the types of epilepsy, because we realized that the manifestation is different depending on the type that you have. So take us through some of these types. Let me hope putting my mic up and down is not part.
I don't believe so.
Okay. I'm now safe.
Yes, there are various types, but we can put them into small clusters. So the major ones are two.
Okay.
It can be focal or generalized. If we talk about focal, we mean that a certain portion of the brain is affected. Then generalized, perhaps the entire brain generates those uncoordinated electric impulses like we talked about. Now if you look at the focal, which is a certain part, just part of the brain is affected. A certain part of the brain is where that electric dysfunction is causing the other seizures. So under focal we can look at there are various types, but with focal we have where there is loss of awareness, and there is that where an individual maintains the consciousness. So in focal, you may find that an individual will have a seizure, and the seizure will affect on a certain part of the body.
Okay.
One part of the body. It can be the arm, it can be the leg. Yes, it can just be, you just like have a seizure and then stay for a long period of time, then have the repeated blinking. You see him blinking repeatedly. Then some will just go into, there's a deja vu. Deja vu is basically a situation where you feel everything is familiar. You've been to that situation before. Yes, it's such a feeling where an individual feels like, but I remember I was in this place at some time and we were speaking the same things. I saw the same thing. That is deja vu. So that situation, an individual will have that. Yes. Then, and that person may perhaps keep the awareness. Then there are those where an individual will have to lose the consciousness. Sometimes have jerkings, the one we talked about.
Yes.
Then fall and lose consciousness for some time. Usually these fits do not last so long. They last about 2 to 5 seconds, but they keep on reoccurring sometimes. Yes. Then you have the generalized. The generalized, now you'll have the other aura we talked about, that feeling of something is about to happen. A person will have the other things we talk about. Some will lose even consciousness. Then the fits may spread throughout the entire body. Okay, there are various types where one may have stiffness of the muscles, whereas the other one may loosen the tension in the muscles. Then the muscles become loose. Then these ones last more than the other one. And these ones are these ones are the common ones basically. And they are mostly in children, the young children. Yes. And you'll find that this is where you will have individuals who will urinate on themselves. Okay. Some will bite their tongues. Some will fall and have a injury. Okay. And then the fits may reoccur again in the same manner or same situation, like. Okay. And these are usually due to some triggers. Some triggers can be noise. Yes, it can be noise. It can be these flashing lights. Yes. And most of the epileptic patients are advised not to go to such like a discotheques where the sounds are booming. You have those changing lights flashing, because those may trigger a fit themselves. Yes. And some may experience fear, and some will start hallucinating, seeing things others do not see. Yes, that is where now the complication comes in, that an individual may look at a person as a lion coming to attack. Yes.
So as we are seated here,
yes,
instead of seeing an individual, I see a lion
coming to attack me. And what do? I either run away or stay and fight. So those are cases where you see individuals like the other mom was talking about, individuals now being beaten, become aggressive. Yes. So to break it down, you have those two, the focal and the generalized, but they also have many types within them, like the tonic. Yes. And some are even combine themselves, like the tonic chronic, which is the most dangerous one. Okay. That one, the general one people see, where a person fits and then stumbles to the ground, loses consciousness, solves on himself, and then have those body jerkings, bites the tongue. Yes. Then there are some types where I'll not lose my consciousness. I'll just become silent, drop whatever I've been holding. It may last 2 to 5 seconds, and some people will not even recognize it. You call Martin, and Martin is absent-minded for some time, and he's staring at one position for a long period of time. Then before you know, he comes back and he's asking, what happened? Like, I was calling you. You get it? Yes. So I think I've described some of the types.
Yes, and as we talk about the types, this, I don't know if this is a misconception. What someone is asking, are there specific months in which these attacks happen? Because I think this is what the community believes, that there is a specific month, and so if any parent has their child having epilepsy, they'll guide them not to move around because anything can happen to them.
Yes, it is weird to say it is true to some individuals. Yes, an individual might be seizure-free for a long period of time, but when there is this period when the moon is rising, yes, most of the people are affected, perhaps because of the season, the weather conditions that come in, or the change in the environment itself, because I told you about the triggers.
Yes.
So you will find most of those people, epileptic people, will have fits within those periods when the month is rising. It can be related to the weather and the environment at display at that moment that triggers an individual. Because if you look at that period, there are a lot of changes in the weather itself. The atmosphere, the weather, you get. So I think that triggers most of the patients, and they will have fits. Even some on medication, you will find they are having a fit at least once a month or twice a month because of such environment. So it is true.
Let us look at the intersection between epilepsy and mental health.
Yes, being a brain disorder, it affects the other three dimensions talked about. It's a neurological, basically. Neurological means it has to do with brain functioning. Yes. So it affects an individual's cognitive functioning. And in cognitive functioning, we have aspects like memory, level of consciousness, judgment, intelligence, thinking, okay, orientation, okay, and this individual will have one of the impairments in the cognition. On top of that, I talked about the hallucinations. Okay, this individual will start having hallucinations if the fits are not controlled in time. It keeps on severely the brain functioning. So an individual will start hallucinating whenever he is going to fit. And any disorder or disruption in the perception of an individual becomes now a mental illness. Okay, and these individuals are going to have also disturbances in their behavior. Like I've told you, this person is always going to fight individuals, assuming or presuming these individuals are going to attack. Then, in a long run, some may develop anxiety. Okay, because imagine this individual who does not lose awareness is going to start panicking, thinking that anytime I'm about to fit, and if I fit, I become like a nuisance to individuals. So that brings about the panic in an individual. So an individual is not sure when or not he or she is going to fit. So it becomes an anxiety. Then some will develop depression. Some will develop depression, and some end up even committing suicide because they can't handle. Now imagine that the mother, if the mother is going through that, what about now the individual who is being affected directly? The mother is even looking at alternatives of sending the child to a boarding section, which will also worsen the condition. You get it? Because a secondary school will have much of these young people who do not understand this condition, and they are going to bully and tease this individual. So that thing will also affect the kid. Then in one of the complications of epilepsy is what we call status epilepticus. So status epilepticus, we have an individual who is having fits frequently. He will get a fit within a fit, okay, and they will last more than even 30 minutes. An individual is recovering from a fit, he gets another fit there and then. So the fits are continuous, and that is a psychiatric and a medical emergency. So we need to intervene in very fast and help that individual.
Okay.
Yes.
Now, of course, before we started, we had a news story that was today they were launching epilepsy surgery here in Uganda, and someone here is also saying, since it is genetic, according to the explanation, can it be treated? Is surgery the only option for treatment available, or there are other treatments?
Yes, there are other forms of treatment, like in the news, the director of the hospital, hospital, emphasized on early treatment. Okay, there are some forms of epilepsy that will go unnoticed, and an individual will even recover from them. Okay, then there are those forms which are going to persist through to adulthood. Then there are those that are going to become severe. The more the person gets the fit, the more severe they become. So early detection is essential. Understanding that this individual...
Before we go further, early detection, how is epilepsy diagnosed?
Yes. We can diagnose epilepsy if an individual gets more than 2 fits, okay, after 24 hours, which are not unprovoked fits. If I talk about unprovoked fits, I mean fits that cannot have identified causes. There are those which you can identify that this one got a fit because he used this drug, and this drug has one of the side effects is convulsions. Then there are those who take alcohol and have RAM fits, yes, as a sign of withdrawal effects from alcohol. So those ones we can say this fit came about because of this and this. But then unprovoked fits, we don't know what is the cause, and you have more than 2 in 24 hours. After 24 hours, today you get a fit, tomorrow you get a fit after 24 hours, then the next week you get a fit, and they are identical in their nature and characteristic. Then we can identify that as epilepsy. Then also you can have behavioral changes. For example, one of the type of epilepsy is temporal lobe epilepsy. So temporal lobe is a lobe in the brain that basically looks at memory, orientation, most of the cognitive functioning. So if you have individuals who have disruptions or disturbances in such, and at some time they are losing consciousness, okay, like one of our colleagues here was asking me, is it, if you see people losing consciousness, is that epilepsy? One individual asked, yes, sometimes it is epilepsy. Sometimes it can be other disorders. Yes. So, but now another issue is that we can use some brain imaging techniques to identify tests. For example, the MRI, magnetic resonance imaging, to detect on the brain activity. We can do a EEG. A EEG basically is a test that helps look at how your brain is functioning with those discharges in the brain. So if they find that they are abnormal impulse, it displays the impulses. So if there is any abnormal activity uncoordinated, then we can also diagnose epilepsy there. Then yes, there are also blood tests.
Okay.
Yes.
Now we continue with the treatment because it's what we are talking about. And then diagnosis came in.
Treatment. Most of the time, these people we have to give them medication to swallow. The good thing is some, like we said, some forms can be self-treated and then they vanish. Then it is a lifelong treatment. Unfortunately, the bitter part about it, the bitter part about that treatment is that this individual has to be on medication
forever
and religiously. Religiously, I mean every day. Yes, and you have to take it on time. So it helps that it controls the other fits. Then in a long run, we can do tests and see. So if, for example, if you have been on that medication for more than 2 years, and in those 2 years you've not reported any fit, then we can consider tempering on your medication and see how we can work out. Some people can even stop medication at some particular time. That means if you have been taking this medication religiously and you detected it early, yes. Unfortunately, the rest have to be on medication. Yes. Yes. Some forms are not curable.
Okay.
Yes.
Then which forms call for surgery?
For example, if the cause was due to a vesicular problem, stroke, that one you can do surgery and clear that out. Okay. There are some portions where the brain, we have detected where the brain is affected. That one you can also do surgery and go about it. Yes.
Wow. So as we draw closer to the end of this conversation, what are some of the advice? How can you advise the general community, but also parents who have children with epilepsy?
Yes. One is to understand that epilepsy is not contagious.
Okay.
To drop all those myths about epilepsy. And then two is to look at the safety of this individual. So if an individual is getting a fit, it is very, very important for an individual, a caretaker, a bypasser, be it you yourself, Mr. Mkalas, if you are passing by someone who is fitting. It is very important to help this individual clear away all the dangerous. Okay, don't tamper with this individual because they will fit for some means and stop. Don't try to stop him from fitting. And okay, then there is a myth of where people believe that you put a spoon
between the teeth.
Yes, to avoid him from biting. Or don't put anything inside a fitting individual. Okay, don't put spoons. Don't put inside. Don't
even when they're biting the teeth.
Don't do anything. Yes, don't. Just help this individual to one side of his body. Okay, then clear away the dangerous objects. Okay, you can caution or put something softer on the head to avoid the head injuries. So when this individual has finished fitting, please kindly place him to one side, to what we call the recovery position. So basically you position the head, you tilt the head so that the circulations can be able to come out. Then make sure this individual gets the atmosphere is not crowded so that this individual can get oxygen.
Unfortunately, in Uganda here, people gather and everyone wants to look out, and people are getting out phones to take videos.
Yes, that's why I'm saying an individual, a good Samaritan. Please mobilize these people. You can tell them he has a problem, he needs space. I think people will understand. Yes.
A few at least.
A few. But That's why we need sensitized people. And the other aspect is these individuals are always encouraged, if you have been diagnosed with epilepsy, you're encouraged to carry a document that identifies you as an epileptic. Sometimes they are given wristbands that indicate they are doing epilepsy with additional information on how to manage them. You'll find them with wristbands that has epilepsy, or a tag, or some information within themselves. So this one at least helps an individual on what to do. Unfortunately, we are not doing it well here, but we are trying to emphasize it. And the other is, don't some have a policy of inserting herbs? Yes, pouring some herbs on these individuals. Don't. Then you can call for medical assistance after that. Okay? Then if you have epilepsy, please don't drink alcohol. Avoid crowded places. Avoid noisy places. The triggers we talked about, the flashing lights. Yes, and these individuals have to control stress and take their medication religiously. Yes.
Unless there is a word you want to share with us, but Brink has already started warning me that we have a few minutes on us.
Yes, I'm happy about the previous shows. Actually, I've got overwhelming numbers calling me about mental health. That indicates people are seeing this show and are following us. I would encourage people to seek mental professional help, and I'm available for any individual. Like last time I shared my contacts I don't know if
there is that one who wasn't, who didn't watch last week, and they're only watching today.
Some are also asking me, where should we find you? Well, I'm available at Butabika National Referral Hospital, but I do my private sessions also at my clinic. It's located in Chengera Mugongo. It's called Mugongo Medical Services. You can reach me on 0704 285031. Those with MTN 0787 926 709.
Thank you so much, and thank you so much, you viewer. Let me thank a few people who were engaging on social media. One is the one Mr. Chigundu Selegio Musomesa from Luwero. Thank you so much. There is Simon Maganda, Ndaula Aisha, Ken Muksa, and very many other people who are engaging on social media, on Twitter, but also on YouTube. Thank you so much. This has been Family Hour for today. Tomorrow is a Wednesday. We shall be back with our edition of Finance. Now tomorrow we shall be continuing with our series of taxation, so you do not have to miss as we continue. But also Family Hour continues up to Friday. Remember, Thursday is leadership and governance, and Friday is parenting. You might say our children are back to school, we don't need this series, but you need it because they are your children. The teacher is only having them for a short period of time, but they are yours forever and ever. Norman Conte in transmission, another bougie dude we have around. Then we have Raymond Tonena. Sometimes he wonders, people wonder whether you speak, but one day we shall bring you here and you tell them whether you speak. And Brinko Ategeka, who is producing this particular show, and the entire team. It's a good night. Next on your TV is Soul Moment.
Do you know that you can now enjoy